Operative pain of single visit endodontic treatment with gutta-percha versus MTA filling, a randomized superiority trial carried out by Khabiri et al. Within the group, we could find Mahmoud Robinjad as well. Post-operative pain has remained a challenge for clinicians. This randomized superiority trial compared the levels of post-operative pain following the use of gutta-percha and concealer or MTA as root canal filling material in teeth with asymptomatic apical periodontitis. Methods: a total of 119 patients were evaluated in this two-arm parallel group single-blinded superiority randomized clinical trial. The inclusion criteria were participants aged from 18 to 65 with single canal premolars as diagnosed with asymptomatic apical periodontitis. Then they were either filled by gutta-percha or MTA. These canals were prepared up to size 30 with an apical size of 0.30 millimeter, and then the MTA was pro-root MTA with a 3:1 ratio. 3 to 5 millimeter thickness was left. The results: the mean VAS score decreased significantly over time in both groups. Female patients reported higher VAS scores. However, the VAS score was significantly lower in the MTA filling group. Analyzing these results, this trial demonstrated the use of MTA followed by colonoscopy with the GP root canal filling material in significantly less pain with the use of GP and sealer. One way to describe this analgesic effect is that the MTA injection did not excite. An example was an in vitro animal study, in which MTA injection did not excite the nociceptor action and had some analgesic effects similar to ketoprofen. And the analgesic effect has been attributed to outward flow of potassium ions and membrane. However, no human studies support this. And females tolerance to pain. These differences could be explained by the different reproductive organs, unstable hormone levels, and higher psychosomatic disease that can lead to higher post-operative pain in females. We also have to remind ourselves of the drawbacks of handling MTA, difficult retrieval and discoloration it may produce. This was the first investigation dealing with or studying MTA and pain. My opinion is that in this study we could see that clinically, in the cases in which we use MTA, we usually deal with much more wider sizes than the 30 size they used here, and also the exclusion they did for teeth that extruded or had some material visible radiographically beyond the apex, which should have been included as well. Also, these procedures were handled in an optimal conditions, but this kind of study does not study the actual effectiveness of this pain reduction. Thank you for listening.